And welcome to the Dr. Bob Show. We'll be spending most of this show talking about a small gland in the neck. It's frequently called the Great Masquerader. Why would it be called that? That's because it can masquerade different diseases, like don't feel well, like depression, like down in the dumps, like nervous all the time, just agitated, nervous and perspiring, and something's going wrong and shaky. Or maybe overactive GI system, or maybe can't sleep well, or it's just a great masquerader. And if we don't think about this gland, the thyroid gland, we can miss an important diagnosis. We'll be talking about the thyroid gland and what symptoms it can produce. My guest is Dr. Rebecca Jackson. Dr. Jackson is a board-certified internal medicine specialist, and the thyroid is one of the diseases she always looks for because she knows it can be a great masquerader. We're talking with Dr. Rebecca Jackson, board-certified internal medicine specialist, and we're talking about the thyroid gland. I call it the great masquerader. Rebecca, welcome to the Dr. Bob Show.
Thank you, and thank you for having me.
All right, it's always my pleasure and my honor. Now, tell me about the thyroid gland. Where is it, first of all?
It's a gland, it's a butterfly-shaped gland that sits right about here in the neck. So right underneath the Adam's apple is a little adjoining piece of the thyroid, and there are two wings that sit on either side. And the thyroid gland is responsible for metabolism. Now for young kids and for children, it's responsible for growth and development. As we get older, it's responsible for hormones that maintain a lot of bodily functions.
So when you say metabolism, what kind of metabolism? The cell structure, the GI tract, what kind of metabolism?
Metabolism in all kinds of ways. Turning over of cells in multiple areas, like the bone, the skin, responsible for contractility of the heart and the heart rate, contractility of the GI tract.
Pretty important.
It is. It does a lot of things.
Does it put out a hormone that's responsible for those things?
It does. It puts out two hormones. There's T3 and T4.
T3 and T4.
3 has 3 iodine molecules attached to the thyroid gland, to hormone. T4 has 4 iodine molecules attached to the hormone. Your body really only needs T4 because it can turn T4 into T3 by just getting rid of one of those iodine molecules.
Is either one stronger than the other? Is 4 stronger than 3?
Not really. T3 is what the body actually uses in the cells. So once T4 gets converted to T3, the body can use it just fine.
How does the thyroid gland know how much T3 or T4 or hormone to put out so that the body can function?
This is a great question, and my favorite part. This is one of the reasons I went into medicine, because I just love how this works. So it's like a negative feedback loop. There's an area in the brain called the pituitary gland, and it puts out thyroid-stimulating hormone. So that hormone stimulates the thyroid gland to make hormone. When the thyroid gland makes hormone, there's a negative feedback loop. The level of that hormone turns off the TSH.
So if the pituitary gland stimulates the thyroid and the thyroid puts out hormone and the hormone comes out, it's in the bloodstream, and then it goes back to the pituitary gland and says you don't need to work so hard?
Exactly, like your thermostat, right? Comes on, heats up, and then it says, you know what, we're hot, we don't need to work anymore. So,
pretty accurate.
Yeah.
The pituitary gland does a good job with the thyroid gland?
Does a fantastic job. And the TSH is a wonderful test.
If the thyroid gland puts out too much hormone, if it's too active, if we have hyperthyroidism, what symptoms do people get?
So too much is going to be responsible for an increased metabolism. So things are going to speed up, and not necessarily in a good way. For the brain, things really speed up.
The brain just working like mad?
Yeah, irritable, train of thought can be messed up. And a lot of the trouble with it is insomnia. People with hyperthyroidism can't sleep, which causes a whole litany of problems, as we know. So that's part of the problem. The heart can speed up. Heart rates can get very fast. The blood pressure can go up. You get hot and sweaty. It's almost like being nervous, almost like an anxiety issue. Nervous, sweaty, heat intolerance, weight loss in spite of eating more.
Wow. Now, when we were talking about being nervous and emotional and then hyperactive, that sort of thing, do sometimes people get the wrong diagnosis? It masquerades as anxiety or as a psychosis type problem?
Yes, it can. It can very well, except that there are some markers of hyperthyroidism that are hard to miss. And one of the things, and people get this with anxiety, is their eyes get really wide. You can see the whites of the eyes, and so that's kind of a symptom of hyperthyroidism that you don't necessarily get with anxiety. And the weight loss in spite of eating more is also something that you don't necessarily get with anxiety.
You always marvel at some people that say they eat anything they want to and yet never gain any weight. And in the back of your mind, you say, I wonder if they've got an overactive thyroid that's working.
People with an overactive thyroid are miserable. They are just on edge. They just don't feel good, though.
What do you see on physical exam when you're examining somebody that's got a hyperactive thyroid gland?
So their hair might have thinned a little bit, and what you will notice in their face is that they have lost weight. And their face is often red, they're flushed, they're sweaty. And you can hold out the hands, and you can see like a fine tremor in the hands. Heart rate's going to be fast. Even though they're sitting there doing absolutely nothing, that heart rate's going to be fast.
What's fast?
Over 100.
Oh, so that's really very, very, very significant.
For someone who's, and it might be 112. Some people actually their heart gets out of rhythm when they get hyperthyroidism. They go into atrial fibrillation or some other supraventricular tachycardia. So that can be a trigger that their thyroid is overactive.
So if somebody's coming in with a fast pulse, if their eyes are wide open and bulging, if they look like they've lost weight, if their skin is moist and smooth, is it a sort of nice skin? If somebody's got hyperthyroidism, their skin feel nice and soft and moist, or
it's sweaty.
It's sweaty.
It's sweaty and hot and red, yes.
We guys call that a sweat hog.
Yes.
So if somebody has an overactive thyroid, too much hormone in there, what happens in the pituitary gland? What's going on?
So that's that negative feedback loop. So there's so much hormone being produced from the gland that it shuts off that TSH. So that TSH number that we were talking about, that's easy to measure with a blood draw, is going to be less than 0.01. It's going to be even hard to detect. It's going to be very low.
So it's going to be low. Immediately the doctor says, low TSH, I better think about an overactive gland.
Exactly.
And then you look. If you feel an overactive gland, does it feel different sometimes?
Sometimes it does. It can be enlarged, or we call it goiter, and it can feel rubbery, kind of, you see it stick out, and it'll feel a little rubbery.
How do you treat people with hyperthyroidism?
Great question. So there's 3 ways to treat. You can use medicines, which will keep the thyroid gland from making hormone. So 2 medicines, methimazole and propylthiouracil, we'll call it PTU because it's a mouthful. Iodine, radioactive iodine, will just sort of kill off the gland, and that's going to be a definitive treatment. Once you've decided to kill off the gland, it's done, and you're going to have to be on thyroid medicine. The nice thing about medicine like methimazole and PTU, you can put someone on that for a year or 2, and you might be able to take them off of it, and the thyroid gland goes back to normal.
Which would be great. The less you have to do, the better that would be.
And the other treatment is surgery, and sometimes you just take out part of the gland that's causing the trouble, partial thyroidectomy. May or may not need medicine, but a lot of people will opt for a total thyroidectomy, and that's also definitive, and you'll need to be on thyroid medicine for life.
When somebody is hyperthyroid and they're going through the ravages of an overactive thyroid, what's it like when they finally calm down?
Oh, it's so nice. Oh, they feel so much better. They can sleep. They can finally put on weight. They're not sweating all the time. They just feel so much better.
And I would anticipate they're not as agitated, not as irritable, because when they calm down. It's almost like taking something that settles you down. Are there problems with an underactive thyroid?
Yes.
And that's what we're going to be talking about when we come back. We've talked about hyperthyroidism, overactive thyroid. It can really be a problem to people. Now we're going to see what about the underactive thyroid. It can be a big problem also. We're talking with Dr. Rebecca Jackson, board-certified internal medicine specialist. We're talking about the thyroid gland, a little butterfly-shaped gland in the neck. We've been talking about an overactive thyroid gland and how it makes people nervous, fine tremor, heart rate goes up, sometimes causes some heart rhythm problems, can change it where they can't sleep and they don't feel good. It's a really tough illness, but there is treatment. The treatment's very effective. Now we're going to be talking about the underactive hypothyroid. What happens and what symptoms does somebody have?
So that is the great masquerader, hypothyroidism, because the symptoms of hypothyroidism sometimes mimic life: fatigue, weight gain, trouble with memory, sleeping a lot, being cold, dry, brittle hair, hair loss, dry skin, constipation.
Just think your old age. It's part of old age. And all of that can be
Yes.
due to the thyroid gland.
Yes.
So when the thyroid gland is underactive, not putting out enough hormone, then the pituitary gland sees that there's not enough. So what happens to that TSH?
So it's that negative feedback loop. So the thyroid gland is not putting out enough hormone. The pituitary senses that and says, hey, gland, get going. So that TSH goes up and up and up, expecting the gland to put out more hormone, but it just doesn't often. And so it just keeps going up.
When you see somebody that's hypothyroid, is it fairly common?
It's very common. It's about 5% of the population. Women about 5 times more likely than men. But as the population ages, it's up to about 10%. And we're catching it more and more. There are general health panels that you go in and get when you have your physical. And it's part of a general health panel. So you can often pick up on a TSH that's going up. You look at it year after year. It might be 1, then the next year it's 2, then it's 3, 4, and then 5 is starting to get abnormal.
It's really working like mad trying to get the thyroid gland to do its job.
Yes.
Now, let's go through the symptoms again. What's the skin like with hypothyroidism?
So it's very dry. Dry skin can be flaky, cold feet, cold hands.
What does cold intolerance mean?
Cold intolerance means you just can't seem to get warm. You put on the blankets, you turn up the thermostat, and nothing seems to get you at a comfortable level.
Not even another blanket.
Often not.
And so the skin gets dry. What about the voice?
The voice can get hoarse, and that is something that we don't see a whole lot of. It tends to happen when the hypothyroid disease is very bad. We don't see that as often, but we will see a slow pulse, constipation. Things slow down in here, so
GI tract gets slow too.
Yes, it does.
So, and somebody's gaining weight and they feel miserable.
Yes.
Does it mimic, let's say, depression?
It can mimic depression. You don't have the energy to get up and do things. You want to do things, you just don't have the energy, and that gets you down.
When we've talked about dementia on some Dr. Bob shows, we've talked about sometimes the big masquerader, somebody thinks they've got dementia, is just a thyroid gland.
Absolutely. That's one of the tests we do when we're working up someone with dementia. We get a thyroid test because it's so easy to fix.
Now, so you fix hypothyroidism, the gland not putting out enough thyroid hormone, by what?
By giving thyroid replacement medicine, thyroid hormone. Levothyroxine is what we call it. That's its generic name, and it's that T4 I was telling you about.
So when you give them T4, how do you measure? How do you know how much to give? Do you give a whole lot and
so
bring
the
it down?
feedback loop kind of changes a little bit. Now the pituitary is going to respond to the dose of the medicine that you're on. So if you're on too high of a dose, that TSH is going to go down. If you're not on enough, that TSH is going to go up. So that's important to remember, because sometimes when you get your blood work back from your doctor's office, it's opposite of what you think.
And the patients, when they respond to the thyroid, what do they tell you, the doctor?
They feel so much better. They can stay awake all day. Their thought processes are better. They're starting to get a hold of their weight gain.
So that thyroid gland is pretty important to the overall health of a patient, very
Yes.
significantly so. What's Hashimoto's disease? That's a big, long name, so I like to use it. So that disease of thyroid gland, what is it?
Hashimoto's is an autoimmune disease, the most common cause of hypothyroidism in the United States. Probably worldwide, the most common is iodine deficiency, but we put iodine in our salt and in our food, so we don't see that in the United States. So Hashimoto's is where your body makes antibodies to the thyroid gland here. And so over time, it destroys the gland, and the gland can't put out the hormone.
And I think, as I have learned about Hashimoto's disease, it's a very slow evolving, like, you know, it wasn't very bad last year, and it gets a little worse and gets a little worse.
Right.
And it's something that maybe that everybody in the family doesn't notice.
Right.
But when you get that pituitary gland TSH, and if they're hypothyroid, then it's going to be high because it wants the gland to work more.
That's correct. And the gland just can't because it's been damaged.
Does the goiter or the gland ever get big enough to where it begins to put pressure on the neck?
It can. We don't tend to see that. Like I said, the thyroid hormone is on the general health panel. So we generally don't see that because we tend to monitor that every year. But for someone who hasn't been in a long time, that's sometimes what they come in with, is a enlargement of the gland, and it can push in on the trachea and cause trouble breathing, or the little butterfly areas on the side can push in on the esophagus, and you can have trouble with swallowing.
So there's lots of things that it can masquerade.
Yes.
And we always have to think about the thyroid gland. If somebody people pay attention to their skin and its texture. If the skin texture is abnormal because of hypothyroidism, it would be, you said, dry and flaky.
Flaky. You put lotion on, and a few minutes later, it looks like you haven't put anything on. A few hours later, the skin's already flaky again. Just very, very dry skin.
What is the energy level of somebody that's got hypo or hyperthyroidism?
So energy level for someone with hypothyroidism, they're sluggish. Just don't seem to have the energy. They sit down and they might nod off and take a nap. Someone with hyperthyroidism, they're just ready to go all the time. And unfortunately, they can't sleep, which is pretty miserable.
Yeah,
right?
And it's very detrimental to your health. Can you see the thyroid gland? Do you ever look at somebody's neck on television? I do it all the time.
I do.
Okay.
Yeah, I do. Most people, you cannot feel their thyroid gland. Some people who are thin, you can feel it a little bit. Most people, you cannot feel the thyroid gland on, but you can see one that's enlarged from a distance.
What's a nodule?
A nodule is an area in the gland that can grow. Very common to have thyroid nodules. Most of them are benign. They sit there and they don't put out any hormone. If someone has a thyroid nodule that you can feel, you want to get an ultrasound and see how big it is. If it's, let's say if it's 6 millimeters, which is maybe 1/4 of an inch, you get an ultrasound the next year just to make sure it hasn't grown, because most of those are benign. If it hasn't grown, you might get an ultrasound then 2 years down the road and then 3 years down the road to just keep an eye on it. A toxic nodule is one that will put out hormone. A cancerous nodule will get large, and it's one that you're going to seek because it gets larger in ultrasounds, or ultrasounds. When it gets above 1 centimeter, which is 10 millimeters, that's one that you probably want to biopsy.
And the biopsies, not like they used to be. They're pretty simple now.
They are. It's just a
little needle in there,
yes.
and then you look at that under the microscope,
Yes.
and you can tell what kind of cells are there.
Exactly. And not that anybody would, I'd ever want anyone to have cancer, of course, but if you have to have a cancer, thyroid cancer is such a slow-growing cancer. That's the one you want to pick.
And that's what I've always been told. Basal cell of the skin or thyroid cancer in the neck are the ones. Nobody wants to have cancer, but those are so slow-growing and very, very true. Rebecca Jackson, you're a great teacher. Thank you for coming to the Dr. Bob Show, and thank you for telling us about hyperthyroidism. Now, if I can't sleep or I'm nervous or sweating a lot, I'll think of hyper, and if I'm sluggish and just don't have any energy, I'll think of hypo, and I'll think of your teaching us.
Perfect.
Yeah. I want to thank Dr. Rebecca Jackson. Wonderful discussion on the thyroid being overactive or underactive and causing different symptoms.